Hello, my name is Evelyn Fox. I'm doing a recording of a health assessment or health history with my son. He's giving consent. The video will only be utilized and viewed by myself and my instructor for grading purposes only. This is for MSN 572. And is it okay if we proceed with the recording?
Yes, that's okay.
All right. Okay, I'm going to start off by introducing myself. My name is Fox, and I'll be the nurse that'll be caring for you today. Could you tell me what your initials and date of birth are?
DJ, and my birthday is December 11th, 2002.
Can you tell me what brings you here today?
I'm just going to get a physical assessment.
Okay, just your regular annual physical? All right. Tell me how you've been feeling today. I'm going to ask you a battery of questions so that I can gather a good history. Are you resting well?
Yeah, I'm doing pretty okay with my rest.
Any weight loss, weight gain, good appetite?
I haven't noticed anything, but yeah, my appetite's been pretty well.
Okay, what about tiredness or energy level?
Only tiredness I may have is just from school. That's it, just my classes and things like that, just trying to stay up and study.
Okay, so you're in school, all right. What are you working on?
What I'm doing right now is biology, so hopefully I can do the same thing you may be doing.
Okay, all right. So we'll start with asking about your medical history. Do you have any health issues?
No, other than just allergies, just year-round allergies for me. So that's pretty my main thing.
How do you treat those? How long have you had those allergies?
Since I was a kid, what I usually do is just Zyrtec.
Around about what age?
I'll say probably 5, I can remember.
Okay, so about 5. And you take Zyrtec for that?
Yeah.
What are the symptoms that you have with that?
I usually have like a stuffy nose, just like a little congestion, things like that. Maybe slight puffy eyes during the springtime when the pollen and things are out. That's usually about it.
So how often do you take the Zyrtec?
I take once a day.
Do you take it year round or do you take it?
For me, year round.
Okay.
Just because.
But the allergies get worse in the springtime, yes. So the pollen probably precipitates that.
Yes.
So tell me what the dosage of the Zyrtec is.
If I remember correctly, 10 milligrams.
It's the over-the-counter Zyrtec?
Yeah.
All right, okay.
Just when I go to the store, I can just find
And it's once a day, and it works pretty good?
Yeah, it works pretty good.
It keeps you pretty regular. Any other health issues?
Other than, well, I do have eczema. Had that for as long as I had the allergy as well. It usually just within my elbow, just in between my arms and everything, and maybe a little bit behind my ears. It kind of does it during like when it's warmer outside, things like that.
So you've had this since you were about 5 or so,
yeah.
too. And what do you do for that?
I have ointment that I put on it. I think it's called, is it hydrocortisone?
Oh, the hydrocortisone, the over-the-counter,
yes.
The 1%. Okay. And how often do you have to use it when you use it?
For that, it just depends, but usually they have me do it about 3 times. It has on there. So if it flares up a lot, then I just do it 3 times. Other than I can get away maybe with once.
How often does it flare up?
If it's warmer outside during spring or summer, quite a bit for me, but usually not as bad.
And that keeps it controlled?
Mm-hmm.
Ever had any infection from it or anything like that?
Nothing like that.
Okay. What about your social life? Are you where you residing?
I live by myself currently. Since I do go to school and things like that.
Are you dating?
Yes.
Do you attend church, or do you have any religious practices?
Yeah, I attend church pretty regularly, as often as I can. and I'm Christian, so for that, that's a big thing for me and my family. So
Okay, so what's your support system like?
it's pretty good. So I do have my family that I can fall back on, and my friends in school, in church, and everything like that. So I do have a pretty good support system.
Okay, so you sound like you have it all together except for school,
I
huh?
hope.
The stress from school.
I
So
hope.
when it comes to let's look a little bit into your family history. Um, are both parents living?
Yes. Both of them.
Okay. Could you tell me if they have any medical issues?
On my mom's side, I know my on my
Let's start with you have any siblings?
yes, I do have one sister.
Okay. Does she have any health history?
Just the seasonal allergies, just like me.
Okay. How old is she?
18.
Okay. What about your mom?
My mom has high blood pressure.
How old is she?
With her, she's 50.
Okay. And she has hypertension.
Yes, ma'am.
What about your dad?
He has diabetes. I think they said type 2, if I'm correct.
Oh, so he doesn't have juvenile. He hasn't had it since he was a kid. Okay. And how old is he?
He's 52.
Okay. What about your mother's parent, your mom's mom?
My grandma, she has high blood pressure as well. So on my mom's side, high blood pressure does run in the family.
What about your mom's dad?
My mom's
I
dad?
mean-
My granddad, yes. Yes.
I mean, not
Yes.
your mom's dad. I'm so sorry. Your granddad.
Yes. My granddad, he
Well-
he does have high blood pressure. For him, they are a little up in age. So my grandma, she is 65, and my granddad, he is 70. So I guess you can kind of.
Okay. So what about your dad's parent, your dad's mother?
She has diabetes, the same as my dad, type 2, and she does have high blood pressure. My granddad, I don't know much about him. He did die in an accident when he was much younger, a little bit older than me. So,
Okay. At what age did he die?
20, so 23 if I remember correctly.
Okay. How, just in an accident? Okay. So, do you experience any headaches or blurred vision,
No,
hearing issues,
not at all.
a lot of earwax?
No,
No?
just.
Do you wear glasses, contacts, or
No.
no? No trouble with your vision? They don't hurt? I know you're on the computer a lot. I know you probably play the game a lot. No issues with that, with your eyes?
No, other than just getting tired.
Okay, that's good.
Long
No
day.
dizziness,
None at all.
no confusion, no feeling like you're gonna faint,
No,
issues with your taste.
no.
Do you have all your teeth?
Yes. Well, actually, I don't have my wisdom teeth.
So you're with them. All four came.
Yes.
Have they been extracted?
Yes, they have.
Okay. So do you get your teeth cleaned regularly?
Yes, I do.
No issues with the inside of your mouth. No sores or blisters or
None
anything
at
unusual.
all.
Dry mouth or anything like that. Okay. What about your neck area? Any issues? You ever felt any knots or swelling or anything? Any issues with turning it or anything like
Nothing
that?
like that.
Okay. What about chest pain? Shortness of breath?
Mm-mm.
Hypertension runs in your family. Do you get your blood pressure checked, or do you stop out at Walgreens when you're out, maybe and check it sporadically?
Lately, since it has become an issue in my family and things, when I do go out to Walmart, every now and then I do check it.
Okay, and it's always good.
Yeah.
Okay, so any swelling?
No, ma'am.
And then what about with breathing? I know you said you have seasonal allergies, and I know you have a stuffy nose and things like that. But do you ever have issues with shortness of breath or congestion in your chest or
No.
anything? Do you exercise?
Yeah, I do exercise.
Any shortness of breath or any issues or palpitations when you're exercising?
Nothing that I've noticed.
Okay. What about when you eat? Do you have a good appetite?
Yes.
Do you have any issues with your digestive system? And it's excessive gas, abdominal pain.
Everything is pretty normal for me.
But you do pass gas.
Yes.
Just not excessively.
Yes.
Okay. Is there anything that makes your belly hurt or you're intolerant of any food?
No.
I was saying you can eat everything, huh? Excuse me. Do you have normal bowel movements?
Yes, ma'am.
How normal? About how many a day?
Well, since I do eat a lot, I'll say for me, maybe 2 or 3 times a day.
So this is a 1 meal in, 1 meal
Yes.
out. Okay, that sounds pretty healthy. Describe your stool to me. Are they in large amounts? Are they brown, yellow, tarry, reddish?
What I usually notice is they're pretty solid and brown.
Okay, and they're pretty large or little pebbles, or they're just pretty healthy?
Yeah, pretty healthy as
You
far
don't
as
have
I
any
see.
issues with constipation and no loose stools? Okay.
Nothing like that.
All right, well, you did well there. What about with your range of motion, your joints and moving around, and when you're exercising? You're a young fella, so you shouldn't have too many issues with that.
No, nothing at all. No issues in that area.
Okay, so now we're gonna get a little bit personal.
Mhm.
I'm gonna ask you about your sexual preference. What's your sexual preference?
Heterosexual.
Okay. Are you sexually active?
No.
Have you ever had any sexually transmitted diseases
No, ma'am.
or been tested for any?
No, I'm pretty good. I haven't
Okay.
shown anything.
So when it comes to your genitalia, you don't have any, never had any leaking, burning, foul odors,
No, ma'am.
noticed any blistering or anything unusual going in your,
Haven't noticed anything unusual.
anything like that? What about in your rectal area? No issues back there with tears or,
No, ma'am.
what about urinating?
No issue. Everything is normal with it as well.
Do you drink plenty of water?
Yes,
How
ma'am.
much water do you drink, you think?
Probably say I have a half gallon when I work out. I drink about a half gallon, especially throughout the day, at school and things like this. So I try to drink at least a half gallon and go a little bit more if I need.
Do you perspire a lot when you work out?
Not really.
But you do perspire.
Yeah, I don't sweat a lot while working out. So
Okay. Do you use any nicotine?
no, ma'am.
You drink any caffeine?
No, ma'am.
No caffeine at all?
Not at all. I don't like coffee or
Okay.
anything like that.
When I say nicotine, I mean all forms. Do you vape? Smoke cigarettes? Do you use marijuana? Any other street drugs?
No, ma'am.
Have you ever abused any prescription drugs?
No, ma'am.
So other than the Zyrtec and the over-the-counter hydrocodone, do you use any other medications? Do you experience any pain? Do you ever hurt yourself at the gym and have to take anything for that?
I guess maybe aspirin, something like that. Ibuprofen for
Take
just a little
ibuprofen?
soreness.
About how much ibuprofen you think you take when you need it?
Maybe like one capsule. That's about it for me.
You know what the milligrams are for that?
Hmm.
Just the over-the-counter, the
Yeah,
regular.
I think there may
just
be
one-
200
200?
milligrams. I
Okay.
think.
So you might take 1 or 2 of those.
Yeah.
One.
Yeah, just one for me. I don't.
So if you have to take them, do you take them more than once or
Just once.
just once?
Just once.
Okay, so what about your heat and cold regulation of your body? Are you cold when you shouldn't be cold and hot when you shouldn't be hot? Or is your body temperature pretty regulated?
For the most part, I'd say that I'm probably a little bit warmer than usual for me. It's not like I'm burning up, but I usually just feel a little bit warmer than normal. But my body regulation, I say, is okay. Like, I
Okay.
don't feel cold when I shouldn't be or anything like that.
What about your weight? you don't have any ups and downs or unexplained. You work out, so that probably helps control it. But if you stop working out and you said you eat a lot, does your weight, are you able to maintain a pretty steady weight?
Yeah, I do pretty well.
So you think your metabolism's pretty good?
Yes, ma'am.
What about your mood?
It's pretty good as well. I'm pretty mild. So.
Has anybody in your family ever been diagnosed with any mental illness, like depression, anxiety, or suicidal ideations or homicidal ideations?
No, ma'am.
Have you, excuse me, I'm so sorry. Have you ever felt prolonged periods of sadness or depression or anxiety? I'm sure you had plenty of anxiety for school. Anxiousness or anything like that you had to have any treatment for?
No, ma'am.
Okay. Let's see. What about skin issues? When you go out in the summer, do you spend a lot of time outside? Do you make sure that you wear sunscreen?
Yeah, I do wear sunscreen, especially when I am having my family out in the yard, things like that. So try to make sure that I do cover up my unclothed parts.
Do you drive?
Yes, ma'am.
Do you wear a seatbelt?
Yes, ma'am.
How often do you wear a seatbelt?
Every time.
That's great.
Every time.
Do you own a weapon?
No, ma'am.
Okay, there's no weapons in the house. That's good. I'm just thinking, trying to make sure I cover all my bases. Oh, childhood vaccines. Have you had all of your childhood vaccines?
Yes, ma'am, I have.
What about your flu? Do you get an annual flu
Yes,
vaccine? I'm so sorry. Did you get your COVID vaccine?
Yes, ma'am.
Did you get your boosters?
Yes.
What about I'm just thinking. Do you have any questions for me?
None that I can think of right now.
So your medications control your eczema and your seasonal allergies pretty bad. And the only symptoms you pretty much have from your allergies are
just the congestion,
runny nose, and
like
pretty
that.
much stay in your head. That postnasal drip. Does it bother your ears ever?
Not really. Not too much that I've noticed.
Okay. I'm so sorry. Tell me where you work.
I work at Amazon. At the
Okay.
time. Just part time. With it. It is close by my school, so I can get there and get back.
Do you have have insurance? Are you covered?
Yes.
Insurance? You're on your mom's insurance?
Yes.
Any issues as far as covering your health care or bills? You just give them all to mom and dad?
Yeah.
What about any bruising or issues if you bump into things or you find yourself bruising more easily than you should?
Mm-mm.
No issues with that. Ever been told you were anemic?
No.
Do you eat ice? Is it a
just-
habit? Like, do you eat it?
Not really. I guess maybe. No, I don't eat it a lot.
Okay. I was just gonna say, because most people that are anemic, they eat a lot of ice. The hypertension runs it's on both sides of your family, and diabetes is in more than one generation, including your parents with the hypertension and diabetes with either or. So that increases your risk of developing hypertension and diabetes. So you'll have to be careful with your salt intake and watch your carbs. It's good that you work out. How often do you work out?
About 3 or 4 times a day.
3 or 4 times
Wait,
a week. I was gonna
3
say,
or 4
my
times
goodness,
a week.
you can't pass any classes if you work out 3 or 4 times a day. So keep that up. About how long do you work out?
Anywhere from about 45 minutes to an hour and a half.
Oh, you do
just
really
depends.
good. Yeah, you do good. Keep up the good work with drinking the water. With your genitalia, I did forget to ask you about both your testicles did drop when you were a kid. Haven't had any issues there. You know, you should examine them to make sure there's nothing. Each sac examine. You do that regularly?
Yeah, when I'm in the shower.
Okay. Nothing abnormal going on down there.
Not that I've noticed.
Good. Just trying to see. So I did the range of motion. I'm just looking at you to make sure I didn't forget anything. Got your vaccines, got all your childhood stuff done. It sounds like you're pretty solid on your spirituality and your support system with your parents and your friends in school and things like that. Your diet's pretty healthy. Tell me how many meals a day do you eat? I did forget to ask that.
Well, with working out, yeah, I do eat my normal 3 meals. Then I have like my snacks, and I guess after I do work out, maybe they're 1 or 2 extra meals throughout the day. So even if I have eaten lunch and I go work out, I do have to eat again right afterwards because I am pretty drained after that. So just have to refuel. Then have my dinner and my fat boy snacks at night. So. I'll say I probably have anywhere from like 4 or 5 meals plus little small snacks, maybe a cookie or 2, things like that.
Okay, so do you eat a diet that's rich in, what do you eat the most of?
I try to make sure I have a lot of veggies, but for the most part, I'll say it's pretty protein based. I do try to keep it overall well-rounded type of meal, but I do add a little bit.
How often do you eat out?
I can't do a lot of eating out when working out, so not often. I would guess if I have
how
to
many
buy my
times
dinner,
a week do you eat out?
maybe once a week, maybe on the weekend, maybe.
Okay, maybe once on the weekend. That's not bad. 1 meal?
Yeah, just 1.
Okay. Well, you are a college student, huh? So that's not too bad. What about your hair? Any issues with hair being dry, nails being brittle, or maybe hair shedding?
Nothing like that.
What about your skin? Acne? Any issues with acne or anything unusual going on there?
Other than the eczema just behind my ears, things like that. That's about it for that.
Okay. So when you get the eczema, how bad does it get?
I do notice in the summertime when it's a lot drier, it is.
You said you never got an infection from it. So be sure to keep that hydrated, drink plenty of water, try to stay out of the sun if that exacerbates it.
Yes.
Make sure you continue to wear your sunscreen. Excuse me, trying to get over something. And continue to wear your sunscreen. And if you notice that it's cracking or anything like that, it makes you more susceptible, open to get infection. So always be very careful. Behind your ears, just tell people don't play behind your ears. Or I might tell your mom. So, are you sure you don't have any questions?
None that I can think of.
What about your weight? How much do you weigh?
187.
And how tall are you?
6'1".
Okay. So that's a pretty good weight. 187 and you're 6'1"?
Yes, ma'am.
That's not bad. How's school going and how's stress?
Towards the end of the semester, so I'm just a little nervous with just those final exams. That's about it.
Okay. No issues with the back pain or anything like that?
No, ma'am.
Any issues if you do any heavy lifting or working out, I'm sure you work out. When you work out, you do some weights. What do you use to lift? Do you use your back? You use your legs?
I use my legs mainly. Yeah, because I try to make sure I don't end up.
Ever had any issues in this area?
No, man.
Around your what we call an inguinal area, down near your pubic area.
Mm-hmm.
Haven't noticed any protrusions, any soft
No,
areas, or anything like that? Because heavy lifting can cause a strain and cause a inguinal hernia, which is quite common in young men, especially those that work out. Just looking at your head to toe to see if I forgot anything. No issues with breathing, no issues with... I think I'm pretty much done. If you don't have any questions for me, I'm just still thinking to make sure. So continue with your healthy diet. Continue with your support system. Continue with your spirituality, because that's important. Continue with your seasonal, with your Zyrtec for your allergies. And if it gets worse and the medicine doesn't seem to work, just make another appointment to come in to see if we can help you out with that. Watch that eczema to ensure that, try to keep it from exacerbating or getting worse. But don't scratch it and get it all irritated and maybe infected. And if it does happen to look odd, then once again, make an appointment. I think that's just about it, because you don't wear glasses, you don't have a hearing problem. Sounds like you're pretty healthy. Seems like you're doing things pretty good. You don't use drugs. Oh, do you drink any alcohol?
No, man.
Don't drink alcohol. You don't use nicotine at all. You don't have any food allergies. And you don't abuse any prescription drugs. Not sexually active. If you are, or you decide you're going to be sexually active, make sure that you wear protection. And even if, you think you're being safe, it's still not a bad idea to have yourself tested during your annual. And continue to wear your seatbelt. And if you don't have a weapon in the house, that's I don't know if that's good or bad, but if you do, take the necessary precautions. Make sure that you lock it away, or if you go to a house or something like that, you make sure that the proper safety precautions are being practiced. I'm sorry, I'm just kind of making sure, trying to go through my head and make sure I cover everything that I can think to cover. I think we did everything. Yeah, I think we did everything. We covered bruising and stuff like that. So I think you're good. And are you sure you have no questions or anything like that? Okay. Well, I think we can end our session. Just continue to do everything that you should do, and continue to get your annuals.
Okay.
All right. Thank you.
Fine.
That'll conclude. I'm so sorry. Our health assessment history. You can stop it.